I just want to remind everybody that it is now undeniable that the vaccine can cause more myocarditis in men under 40 than COVID-19. So, do you get that? Now,
you're saying my cardiologist was wrong?
So I'm not saying anything about your cardiologist. I'm reporting what this doctor, Vinny Prasad, said on Twitter that because there's a study he didn't just make it up. There's a study, and there it is. You can see that now in overall population, this is the way the CDC and reports this. They say overall for it's worse. You have worse myocarditis if you get COVID than if you get the vax, but they don't break it down into age groups. They're saying if you're 94 or 4 years old, it's the same. No. So he's saying no, that men under 40 have get more myocarditis from the vax than they do from COVID. That's what he's saying, and that's because he's got we already covered this. This is not controversial. What is controversial is the way the CDC reports it. They glump everybody together. They don't say, well, you get more myocarditis in age this to this, but less in this to this. And if you're 70 and over, you get less. They don't do it like that, which is they should. Why do you think they don't do it like that? So I just want to let you know. And one more piece of material before I get to the main story. I'm burying the lead. For children without a serious medical condition, the danger of severe COVID is so low as to be difficult to quantify. The risk of long COVID among children, a source of fear among many parents, is also very low, and that's from the New York Times, and that's from when we had the more virulent strain of the Delta. Also, according to the CDC, among children, the mortality risk from COVID-19 is actually lower than from the flu. Keep those two things in mind. U.S. CDC advisors approve adding COVID shots to vaccine schedules. That means for children. Pfizer expects to hike U.S. COVID vaccine price to $110 to $130 per dose. Those things came back to back. Those things happened back to back. The CDC Advisory Committee on Vaccines on Thursday approved adding COVID-19 vaccines to the agency's recommended immunization schedules for both children and adults. They're doing it right out in the open. They're doing it right out in the open. And of course, they're not going to say anything on MSNBC or CNN or Fox or ABC News or the Wall Street Journal or the Washington Times. But I'll tell you here, they're doing it right out in the open. By the way, looks like it might not take so long for them to build that pediatric market after all. The CDC's Advisory Committee on Immunization Practices, it's called the ACIP, they voted unanimously to add the vaccines to the schedules, which contain recommendations to physicians on which shots their patients should receive and when. Please explain something to me. This is an MD talking on Twitter. If the COVID vaccines are safe for children, why vote to permanently protect Pfizer and Moderna from vaccine injury liability? It's a good question. Several committee members stressed that they were not setting a requirement for anyone to receive shots. Not yet, anyway. The CDC has recommended that Americans over 6 months of age should receive a COVID-19 vaccine. Do you think that the CDC will ever be able to repair the trust with the American people that they've wrecked during COVID? Do you think that they'll ever be able to do that? Do you remember what I showed you at the top of this segment from the New York Times? What they said the risk of children with COVID are? Do you remember that? Should receive. Some parents and doctors who are against COVID-19 vaccine mandates have expressed concerns during public comments at the meetings and on social media that adding the shots to the U.S. CDC schedule will encourage state regulators to require them for public school attendance, and that's exactly what it will do. Adding the COVID-19 vaccine to the recommended childhood immunization schedule does not constitute a requirement that any child receive the vaccine, said Dr. Nirav Shah, an ACIP member and director of Maine Center for Disease Control and Prevention. Well, I'm getting mixed messages. I'll tell you that, doctor. And I'm very skeptical that anybody in the government is ever telling me the truth, and certainly not from Big Pharma. So that you need to be a little bit more helpful than that, doctor. Shah noted that there are currently vaccines on the schedule, such as seasonal flu shots, that are not required for school attendance in many places. The decision around school entrance for vaccines rests where it did before, which is with the state level, the county level, and at the municipal level, Shah said. I just want to let you know, the guy who sits on the Pfizer board, also the head of Thomson Reuters Foundation, London-based charity, Thomson Reuters, president of chief executive officer of Thomson Reuters. Curious that this Reuters story doesn't include any information about what the actual risks to children from COVID is and what the potential side effects for children from the vaccine are. I wonder why they didn't include any of that stuff. I just wonder. I wonder what their journalistic decision-making process is. I just wonder, because it wasn't in the story from Reuters. I wonder why. I wonder why. Let me bring in Jackson the Hair Hinkle. They're doing it right out in the open. What do you think, Jackson?
It just makes me sick. I told you that before we started the stream. We were talking about this, but it just makes me sick what they're doing. And how much they lie, or I shouldn't say lie, how much they distort the facts. Because anytime I bring this up with someone, the myocarditis issue that you had at the start here, which is pertinent to the story of, the vaccine being added to students' vaccine schedules, recommended schedules. They always say, well, the CDC says that it's 7 times more likely to get it from COVID-19 than from the vaccine. Well, the question is in young people, and specifically men, because that's where we're seeing it. It's just so sick and twisted. And my question is, why is there this? Did you see them take the vote on this?
No.
So the CDC has a random panel of God who knows who that's influenced by what companies and institutions, I can only imagine. And they get to take like a vote on this. They have a vote above all of us. They have a vote above parents. They have a vote above schools and municipalities and states, like you just pointed out. And they get to, it's like a group of like 10 people that gets to decide what's the recommended vaccines for people across the country in schools. And they chose this. And it's just like, who are these people? What is their qualification? Because they've lied at every single corner throughout the pandemic. And now we're supposed to trust them with our kids' health? Come on.
All I know is that the vaccines are safe and effective, and that they will they will slow the transmission and contraction of the virus, and they will prevent you from getting seriously ill or hospitalized or death. And they're fantastic. And good for CDC pushing it on to 6 months olds. Good for them. I think it's great. Fantastic. And I'm just reporting the story. I can't tell you anything else. That I can't. There you go. Huh? Fantastic. Hey, we're going to see you in Miami, West Palm Beach, Denver, Palm Springs, Austin, Burbank. That's right. The Saturday after Thanksgiving here in Burbank, and lots of dates in Los Angeles in December. Go to jimmydorecomedy.com for a link for all our tickets and join our premium program when you go there too.